All right, well, good afternoon, everyone. I know the keynote was running a little late. People are still working their way up, but we want to keep everything on time. So again, welcome to the MedTech Conference. My name is Shay Mandel. I am the Executive Director of the AdvaMed Digital Health Tech Division, which we have just formalized here in the last couple of days and approved a board. We have our first board meeting tomorrow. The panel you're attending today is Patient or Health Consumer. The convergence is rapid and here to stay. And this is my favorite topic in healthcare. I think it gives us a really unique opportunity to talk about where digital health is going, how we think about the patient experience, the consumer experience, where those things come together. And with that in mind, I could not be more excited about the panel we have put together for you. I'm going to give you their names and titles, but then I'm going to ask them to introduce themselves, and I'm going to ask them to take a little time to do that. I think it's important for everyone to kind of hear what their company's strategies are, some of the things that they're seeing that's working. The other thing I'll say for everyone is my philosophy is if you remember who the moderator was, that person did not do their job. So we are not going to ask a question, have everybody just respond. We'll do that if we have to, but I think this group's going to be lively and interactive, and I think you'll have a really good show today. So our group, sitting down as far away from me as possible, is Venk Varadin. He's the co-founder and CEO of Nanoware. We also have Lauren Chung. Lauren is a physician and a senior manager of health initiatives with Apple. Urvashi Tyagi is the Chief Technology Officer at ResMed, and Tom Lindquist, actually a payer, Medicare Region President with Centene, and I know this will be very interesting. I should also point out that both Venk and Urvashi are board members at AdvaMed Digital Health Tech. So let's get started. I think I'll start at the end with Venk. Venk, tell us a little bit about yourself, your company, some of the things you're seeing that are working, and a few comments about this panel.
Yeah, so nice to see everybody. Venk Varadin, co-founder and CEO of Nanoware. We're a New York-based healthcare at home remote diagnostics platform. We say healthcare at home, not hospital at home. And we say remote diagnostics, not remote monitoring. We say that differentiation because we are a connected care platform, but our differentiation starts on the ground floor with our sensor technology, which is what we call cloth nanotechnology or cloth textile-based nanotechnology. It is the first and only cloth in the world that has been 510K cleared for capture and transmission of essential performance biomarkers off the skin. And not to get too wonky into the physics, but if you touch the sensors, it'll feel velvety or suede-like underneath your fingers. And that's you feeling billions of vertically standing sensors or nanosensors per centimeter of surface area. So when we talk about on-body sensors, which is really relevant to our topic today, in empowering the consumer or the patient to be able to take care of their own health, we can cut through the typical sources of noise that the body sensors typically run into. So if you're of South Asian descent like me, you typically have to get your chest shaved and the dead skin sanded down to get an appropriate electrical or acoustic signal. We don't have any issues with that on file with FDA and in peer review publications. Sweat and pseudofluids, which causes diagnostic yield to decrease. Sweat and cloth are actually natural adherents, so our diagnostic yield goes up. And we've got a voluminous depth of the amount of biomarkers we capture. So if you got super clean signals and a lot of it, now you can start talking about machine learning and AI in our closed loop pipes. So we have a device and digital platform where we basically replace a cardiopulmonary assessment at home. So we're replacing the stethoscope, the electrocardiograph or Holter monitor, blood pressure line, hemodynamic monitor, respiration monitor, all in one. And because we're time synchronously feeding that data, we understand a individualized picture of a patient's heart, lungs, central vascular and hemodynamic system. So we're a very small company. Lauren and Urvashi surprisingly didn't agree to trade balance sheets with me for the week. But really excited about the topic that we're talking about today. Just as a preview on it, my first talk publicly when we started the company 8 years ago, we talked about this concept of health and wellness and healthcare and the approaches being very, very different. and at someday they're going to converge. And I don't know if we're fully there yet, but we're really, really much further along than we were 8 years ago when I really didn't even understand a business model. So I'm really excited to be with the panel and share our thoughts with you.
Thank you, Venk. Lauren.
Well, good afternoon. I come from Apple, so I don't think the company itself needs any introduction, but what I can do is describe a little bit about what we're doing in health, which some of you may be less aware of. We have 19 different features available that are health and wellness features across the watch and iPhone, also available on iPad now as well. And our goal has always been to empower our users to live a better and a healthier day by providing them with actionable science-based insights and helping them to build healthy habits. We do this ensuring that we maintain privacy as kind of a central pillar in everything that we do. And we're also focused not just on empowering the consumer, but also empowering the medical community by helping the medical community advance research and care through things like our open source frameworks called Research Kit and Care Kit, as well as some of the large public studies that we run ourselves, but also to support around the country. I will say that, one of the things that I find so exciting about this space that I'm seeing right now, that is just the fact that now we're seeing that wearables like the Apple Watch, the devices that you carry with you every day, are now having a tremendous impact on helping users understand what might be wrong with their health or what might be right with it. And so it's really helping people build healthy habits, but also helping them to understand when they might need to go get care and empowering them to have an informed conversation with their physician. And so we're seeing this every day through the letters that we're getting from our customers, where they're using things like our FDA-regulated medical devices, or medical software, I should say, the irregular rhythm notification and the ECG app as an example. And they're finding that they might have a rhythm suggestive of AFib, taking it to a doctor and getting diagnosed with AFib. So we're seeing a lot of really interesting cases where the technology and access to data has really helped empower our users to better understand and take care of their own health.
Urvashi.
Hi, everyone. I work at ResMed, and ResMed is a global leader in digital health and cloud-connected medical devices. We're based in San Diego, if you haven't heard of us. We particularly help people with sleep apnea, COPD, and other chronic diseases, as well as help people who are seeking out of the hospital care solutions. And so particularly, our goal is to help people sleep better, breathe better, and live healthier lives outside of the hospital. So in the comfort of their home or in a care setting of their choice, from a long-term care standpoint. In my role, I would say particularly, I've been at ResMed about a year and a half, and in my role as CTO, I'm responsible for two key areas. One is particularly focused from a technology strategy for data and digital, as well as our delivery of global products. And this includes our cloud-connected and our cloud-based platforms, as well as our customer-facing experiences. And then I'm also responsible for corporate technology, and this includes corporate infrastructure and our corporate systems that actually run our global operations. And so in terms of ResMed scale globally, we have over 21 million cloud-connected devices, and in the last 12 months, we have changed 160 million lives through either a ResMed device or a mask or accessory or a digital health solution. And our mission is to change 250 million lives in 2025. In terms of our broader strategy for the company, Our strategy isn't about, having these devices and connect them to the cloud, because we did that back in 2014. Our strategy as we evolve is about delivering game-changing experiences by bringing and by integrating the device, the digital and data. And so, for example, like if you think of sensors on a device or in a patient's room sending data to the cloud, and then the caregiver and the patient, based on the data, assessment of the data, using some of the insights that you talked about through your company, using the data to engage in a two-way communication. And while they're engaging in a two-way communication, all of it is integrated with an out-of-hospital electronic health record, which is actually using speech to text to summarize the notes. And this entire ecosystem moves with the patient. And so within ResMed, our priority, in the coming years is to focus on building this future.
Tom?
Thanks, Jay. So I'm Tom Lindquist. I'm a Medicare region president for Centene. It's probably the largest healthcare company you haven't heard of. We are the largest Medicaid payer in the country, the largest individual product under the ACA payer in the country, and one of the largest Medicare companies in the country. The reason you haven't heard of us is because the organization has multiple different brands: Ambetter for ACA, WellCare for Medicare, and each of the Medicaid companies is branded by its individual state. So when Shay called and asked if I was interested in joining this panel, I jumped at the opportunity, as I've been doing this for 20 years on both the payer and the provider side. And I've seen an awful lot of change in that time, but not nearly as fast as the rest of the world is changing and moving towards consumerism. When I started in this space, a health plan paid claims and frankly looked at utilization management and how we could reduce costs through limiting care. This was 20 plus years ago. That's not the case anymore. Data is king, and consumerism is taking more and more oxygen in the room. How can we engage the individual we call a member, a physician calls a patient, I call a person. How can we engage this person to take better care of themselves, to prevent those emergency room visits, to engage up front, to reduce cost in the system and provide better outcomes. So that's a lot of what we do at WellCare under the Centene umbrella is working to try to engage the physician and the individual to take care of themselves, to get in to see their doctor, to give them the resources they need to put gas in their car or get transportation to go see their doctor, and even help them make those appointments. So it's a fascinating discussion and topic. I'm looking forward to it.
So I want to pick up on some of the threads, and some of these questions, I think we'll sort of play, here's a comprehensive connect the dots a little bit, because I think all of you have done that in your comments. So I've heard data. We've said patient, we've said health consumer, we've said user, we've said member. Venk said, I thought we'd be farther along, we've made progress, we're not there yet. Everyone has articulated changes. But as consumers outside of healthcare, we collect lots of data, right? We do it on our devices, we're always gathering information, we have visibility into most of the choices we make, or at least the opportunity to do so. And by and large in healthcare, that isn't true. We don't always pick our insurer. We don't always know the product brands of companies we're engaging with in the medical device world. Often our employers provide our private insurance, or we move into the public sector. So when we talk about improvement of the patient, member, consumer, user experience in healthcare, how does that happen? How do we get to where, as Venk said, how do we get there? Your companies are all involved. What are some of the big challenges today around data and engagement with patients, members, users, consumers that are keeping us from kind of realizing the power of digital health? And jump in. I see Venk raising his microphone.
from a historical context and where we are, and this is just my opinion, I think healthcare is one of those things, especially in our country, that historically, and we're starting to see a shift, we never thought of as in our own control. It was sick care. We would only go see our doctor when we got a cold or we got a flu or we had a need for a surgical procedure or something like that. The consumer world is very different than that. You see a commercial, you eat something, you like it, you go out and buy it, right? And we never treated healthcare that way. And so I think when we started with the initial terms of whether it was a user, a person, a consumer, and I use the term health and wellness from kind of the beginning, even just 8 years ago, it wasn't still close enough to healthcare because you weren't changing that sort of sick care mentality. And health and wellness, by and large, at that time was, I would say, was really for the healthy well or the affluent, right? That has changed. Even folks in the villages in South Asia, or South India that my parents grew up in, they've got iPhones now and they're posting TikTok videos, right? Like, that engagement alone, I think, has been a big shift in pushing what people think about in their health, in their own healthcare, even just understanding the initial features of like the amount of steps you would take or something like that. And that started being adopted by our employers who were, providing our healthcare. So I think that historical context is important to understand. And now post-pandemic, which I think was kind of the shock, that force majeure event that nobody could have really predicted, the understanding of going to where the patient is, as Lauren said, being with that patient every day, that was a shock to the system and all of us in med tech, really understanding we can't wait for the patient to come to us. We got to go to the patient. And as Tom said, it's a person, right? And if you take that moniker out, that this is not within the four walls of the hospital or the doctor's office, that person's health is much more individualized when they're living their regular life at home and not in the 30 minutes that they're in front of their physician. And I think that understanding across medtech in particular, but across the industry, was patient or person or consumer led. And so if you're not thinking about user experience in all of those cases, we as healthcare or med tech providers, we're going to miss out on being able to treat these people, persons, consumers, the way that we want to. And the last point, I'll close. I think that the patient or person themselves wants more of this autonomy now. Whether they've become healthier or not is not what I'm suggesting. When you think about an automated car, for example, right? Whether it's safer or not, a consumer still wants to drive, right? And I think that you're seeing that shift now here with healthcare, with their own health. They want to get behind the wheel. And I think we have to thank companies, I'm not brown-nosing here because, there's a $1 trillion company sitting next to me. We do need to thank the convergence of the tech companies that really have that consumer mindset to our industry in medtech.
So I'll add a little bit to this. It's interesting when we talk about how do we get to consumerism in healthcare, because our space is unbelievably complicated. And I'll set the stage just for a minute in the sense of how we pay for healthcare. Just at a 10,000-foot level, you have a couple of big categories. You have Medicaid, Medicare, and commercial insurance, and under those are multiple different categories, and they each have different relationships with the provider community. They have different reimbursement rates, they have different agreements around validity or value and quality, and in order to engage in legitimate consumerism, you have to have price transparency, right? We can go and look at the price of a car and get 3 different quotes for that car, and they're all going to be kind of in that same zone. But if a doctor sees a person in his or her office for for a broken arm, that doctor doesn't know if it's a Medicare or a Medicaid or a commercial patient. They don't know how much they're getting paid to treat that broken arm. The doctor treats the person as a person, but the back office bills and manages the payment for that in 100 different ways. And the person who's seeking the care doesn't really know how that's being paid. The doctor doesn't know how it's being paid. And so when the person is seeking care, how do you find price transparency when it's unbelievably complicated? So that's one of the hurdles I think we have to overcome to get to full consumerism.
I think one of the things I would say when it comes to our world of medtech and health tech, it is super critical to differentiate the data, which is a consumer health data, from patient data. And it's really important because when we talk about consumer health data, it is not a medical device, but then patient data is a medical device. Similarly, consumer health data is not that heavily regulated as is patient data. And so when we look at some of these areas, what becomes, in terms of, as we think about our data products and using data in our ecosystem to drive better experience and better patient outcomes, it becomes important that we do not monolithic the consumer health product data and the patient data. So for example, if you have a product and that product caters to consumer, as well as at some point of time in the whole integrated care journey, the consumer becomes the patient and it's the same product, then the entire product is a medical device. And so in the medtech world, the health tech world, it is important we find that your consumer health product should be separate. It should be a modular product. Your patient health product should be another modular product, and do not put all of that into one monolithic.
Just listening to all the comments here, one of the things that I'm struck by when it comes to the terms that we use are a couple of things, which is one, the word patients in kind of the traditional form has been thought of as a very passive consumer. And so in historical terms, especially before the pandemic, telemedicine hadn't really taken off. And so you were essentially beholden to get the care that you wanted to get wherever was convenient for you, but there really wasn't that much choice. And so I think a lot of traditional healthcare systems as well as providers didn't really think about the experience. It wasn't upon them to find the best experience for you to experience your care, because you're going to come to them. You're going to come to them really if they're good at solving your problem and getting you healthy quickly. And I will say in medical school, that was the big thing we learned. We didn't necessarily talk about people as people. We talked about them as diagnoses, as conditions, and as treatments. And we tried to do it as quickly as we could. And I think that just leads to a bigger problem of then segmenting the patient who's this passive kind of recipient of health with the consumer. And the consumer is someone who's active and engaged, but if we continue to think about them as these kind of separate models, then we're really going to struggle to understand the benefit of improving the experience, making the patient an active kind of consumer of their everyday health in a way that allows them to actually get healthier, but also do so in a way that is engaging, delightful, and joyful, right? So I think that there's a lot of room that we have to play with, but I think part of it is that we have to all realize that it's also important to think about that engaging customer experience.
If I may, on Lauren's last point, I think it's what she just mentioned also almost has to structure a startup like us in a difference in business model, in how we think about what our North Star is in the products that we're building from foundational level. And what I mean by that is, in medtech for like 15 years ago maybe, you found an issue, right, or a chronic disease state or a therapeutic or diagnostic application. You built tech to solve that. And the only thing you cared about was safety and efficacy, because the milestone was making sure that it was safe, it was efficacious. It didn't matter if it was the clunkiest thing out there, because the model was you get FDA approved, Medtronic will buy you, right? That model, because of all the shifts that Lauren has talked about, is not there anymore. Maybe for some cases. They want to see a proven sort of business to some extent. And if it's a proven business, it has to have usability. That has to be part of, it has to be part of your product development as well as your business model. And I don't think that existed in our industry from the ground floor up until recently in some of these trends. I think that point is a very important one.
I will say that a lot of times we do think about if we just make the best thing, it's going to do the best job possible in treating that disease or caring for that disease. But at the end of the day, if you won't get someone to engage with your product or use it, then it doesn't matter how good a product it is. So it's really about making it kind of balancing out the two. Obviously, you want it to be as effective as possible, but in a way that is going to encourage a user to engage with it.
I think it's really interesting points that both Venk and Lauren bring up, because the challenging part is how do you, the point I was making earlier, how do you keep these ecosystems separate yet provide a seamless experience to the user? And so at what point does the consumer, the health consumer, becomes a patient, and how do you not separate that just as product one and product two versus look at across the integrated care journey? So for example, if you look at in the beginning of the journey, what you have is a consumer who's, you're trying to educate them or drive awareness about a disease condition or some preventive measures for diseases. As they go through your delivery pipeline and you follow the consumer gets into a diagnostic stage, or the consumer gets into, once they are diagnosed with something, gets into where they need a subscription. Up until now, they're still a sort of a consumer, a health consumer. But then as they go into those next stages, they are now on a treatment or they are on a therapy, and they're getting into a setup of the therapy, and they move into more of a therapy success. And so then it's about short-term adherence to the therapy or the treatment, long-term compliance becomes important, and very smoothly, within your same ecosystem, your consumer is now becoming a patient. And then you get to this final stage where you're saying, how do I make sure that this patient will successfully use this treatment, and then the patient is getting the best outcomes. And by the way, the cost across the ecosystem should be the best possible cost you can get. And so that's the big challenge in front of the medtech and the healthcare industry is how do you move past this thinking of these point solutions as products, because your user, your customer isn't going to come back for a product, but they will come back for this experience, an end-to-end integrated experience.
And could I just add one more point, Shay? I think the vision of the industry and many companies, I don't think we're saying anything that is groundbreaking, right? There were companies that were doing this or attempting to do this that were just ahead of their time. And I think technological advancements just in the space with broadband and 4G and now 5G, the smartphone itself has made so much, Bluetooth connectivity has made so much of this from a vision standpoint possible. You think of, a company like Dexcom, for example, 20 years ago, the vision of doing, CGM and having patients, manage their own diabetes at home, that really didn't take off until the smartphone came and until, people were engaging with the device on a daily and hourly basis. And even some more recent examples, while the street may be scratching their head, I kind of agreed with their vision. A hospital monitoring company like Massimo bought a consumer company because they need to understand, it's not in their DNA on understanding usability, consumerism. How do I put a product on a shelf in Best Buy or CVS? That's not a med tech thing. We don't know how to do that. And so I think the next 5 years are going to be really interesting in that regard, where probably the number one focus is going to be on experience around the consumer.
I think one of the other really interesting developments that we've seen over the last couple of years, and I think the Apple Watch is a great example of this, is software as a medical device is taking off. And so you have your wellness features, which are the things that you use to keep you healthy and well, but aren't or don't require some of the regulatory burdens that medical devices require. But then they can sit side by side with a regulated medical device. And so the Apple Watch has, as mentioned, 3 regulated cardiac features. But it sits alongside a number of other features that meet the standards and have been validated, but don't require the same types of regulation. And that is just a really wonderful way for users to start understanding and learning about their health while juggling the balance between both the consumer world and the patient world.
So Urvashi, you actually said customer, and I know it's been bounced around, but I want to ask everyone about that term specifically. So, in the consumer world, we have choices based on the quality and consistency of the experience we have with products or companies. We can build brand loyalty, right? Like, I'm the first one to admit I'll always have an iPhone, and not just because Apple's an AdvaMed member. I like Heinz ketchup, right? I'm a Coke guy. In healthcare, we don't often have choice, although I think that's changing. Our set of expectations are low to non-existent. Our experiences are completely inconsistent. This spring, the Harvard Business Review published a study which said the average patient consumer, they will go across 4 or 5 provider systems in any given year. So as you all are thinking about your strategy, the patient really in healthcare has never, outside of the physician, they've never been the customer. And the way we pay for things is changing. So I'd love your insights into how does this reality, and I'll ask the question, is it even a reality, of patients beginning to demand or request more information and a more consistent experience like they do in their consumer life, is that changing the way companies are thinking about how they develop products, who they might partner with to bring data and product together? And then, Tom, as folks weigh in, I'd love to know, will payers put a premium on what their members and customers are really asking for? And will that change the dynamics of the structure of health insurance? You can all jump in. I see everyone's leaning in.
I'd love Tom's perspective on it, not to call him out on how I think the economic model translates into that, because I think that's the one part we haven't really figured out yet, short of self-pay models and patients being more in control or customers being more in control of their own. I think the difference really is, and Jeff Martha nailed it in the keynote, the CEO of Medtronic, customers don't really know who we are, right? You could ask the average customer or American consumer, do you know what Medtronic is? And they're like, what? And it's because of how our sort of society and as Americans, we've kind of developed that brand loyalty, right? When we watch a football game or a basketball game, you're not seeing a commercial from Medtronic, right? You are seeing, well, Apple aside, you are seeing commercials of those products that you have built brand loyalty on, right? And so it went to my earlier point, a customer will see something and say, I want that, right? Whereas, we only really thought about health when we got sick before. So I think with connected devices and Lauren's point about having what you would traditionally call a consumer device, because Apple has an awesome commercial and the privacy is there, and the Mac versus PC, the Mac guy was just so much cooler than the PC guy, from back in the day. I love those commercials, by the way. But now it's sitting alongside actual healthcare features or medical features side by side. And I think that will change customers. But again, Tom, maybe I'm just punting you the football right now. Does engagement actually drive how you would think of a next-gen model? Because, to Lauren and Urvashi's point, if you build something that's fantastic but people aren't using it or engaging on it on a daily basis, why would you pay for it as a payer, right? And so I wonder, even if you haven't looked, we always want to point to the outcomes, right? If the outcomes work, I'll pay for it. That's hard to prove in a lot of these use cases with new technologies. But maybe we start with how much are they engaged first before we understand the macros on the outcomes themselves.
It's a great question, and I don't know that anyone knows the answer. As it relates to consumerism and brand stickiness, you know, all of you in the room are going to, for the next 2 months, see commercials for United and Humana and WellCare, because it's AEP. The Medicare Advantage population is going to be choosing a plan, and that's all that's going to be on TV, right? But they're not picking the products underneath that. And so representatives on this panel with their products, and those of you in the room, there's some cool stuff that I've seen and heard at this conference. No one knows about that, right? And for us as a payer, and I've run and managed commercial Medicare and Medicaid plans for 20 years, and it's always the same. You get pitched, and the question is, what's the ROI? Can you prove it? And how do I integrate it in my system? And the systems typically are one of the biggest hurdles. And you would think it would be easy, but it's not. You know, integrating all these different solutions, whether they're digital point solutions or independent solutions, with our infrastructure is not easy to do. And a lot of the healthcare payers have old, big, monster systems that have claims data coming in from all over the country. And so when we get to a point that all of the cool technology is able to integrate, then we start taking leaps forward. But in its current form, it has to be something that we can integrate into our systems and that we can prove actually generates a result, because there are thousands of companies that all have the next best thing. And the reality is, in most cases, they all do work. The question is it scalable? Is the cost going to make sense for the integration? And then, and this is the important part, how the heck do we engage the consumer when we have millions of what we call members, and some subset of them who have, let's just say, diabetes? We need to engage them in whatever that point solution is for diabetes. How do we get them to engage in that solution under an umbrella where they're not that engaged, generally speaking?
I think there is plenty of supply for options to your question, Shay, on choices. But the problem is they're all fragmented options. So there's plenty of fragmented choices that the customers have. I think getting to more seamless experiences is just a matter of time. And what we are already seeing is a drastic shift in the expectations of the customers, and they expect, particularly when it comes to access to care, they expect a digital front door because that offers convenience, and they also expect, as they go through their journey, they also expect now that the care itself is also personalized. And we have that in ResMed products. We have what we call personalized therapy care settings. And so it's not essentially, I would say, really on the side of a medical device, but it's on side of comfort and care. And that's the trend that we are seeing, actually, that where customers expect that their access to those choices is easy. It's digital, and then the access that they get is also personalized. The care that they get is personalized. And, you know, we know where this is all coming from. And, you know, a lot of our, you know, a lot of patients are consumers too. And so retail is actually plays a very big role in driving this expectations that the health consumer or the patients have today. And of course, you know, healthcare industry is probably the last industry to transform. And, you know, of course, the first being retail and maybe the second being finance. But we saw in the last decade, between 2010 and 2020, is all of these big financial companies, the big banks, they've all become fintech. And so, now I think it's the decade heading into 2030, the decade of healthcare. And, we'll also see significant convergence happening between medtech and health tech in this decade.
I think that we're already starting to see that, and I think that the pandemic did accelerate this move tremendously. Excuse me. Before, we really weren't as focused, and I'll say this as a physician in my prior life. I was at Stanford on our strategy and innovation team, and we didn't have to worry as much about whether a patient was going to choose to come to us because we had virtual care versus not. And now I think what we're starting to see in the healthcare systems is the need to offer choice, but not to overwhelm. And I think that's one of the things that's really tricky to balance, is to not result in choice paralysis. But I think we're already starting to see that, and I'm also seeing it in the way that I practice medicine as well. So it used to be that I would make a diagnosis and I would recommend something, and usually only one thing, to a patient, and they would accept that. And now how it works is we say, well, I think it's this, and there's 3 options now for how we might treat it. And I'm going to give you the pros and cons for each option, and then you're going to pick, and we're going to work through it that way. And so I think that there's already a shift happening with the way that providers are starting to work with patients, seeing them as consumers and being able to provide them with choice so that they're active participants in their own health.
Shay, I'm going to steal your job for a second and ask a question. I thought Tom's point was when you brought up, 2 months, Humana, you know what I mean? I wonder if the pharma model, which I have my opinions on, but that's a topic for a different day. 20 years ago, when there was D2C approvals on marketing, and my question is actually to the physician in the room, because you just brought up the point of coming in with choices, right? I think it might be this, I think it might be this. That was the boom for pharma, right? Restless leg syndrome, I might have that. Dr. Chung, do I have it? Do I need this drug, right? For example, when I have fall allergies, right? Ragweed, I can't literally function without an antihistamine for 2.5 months. And I went through Claritin, I went through Zyrtec, and I found that Allegro was the best for me, right? And for 2 months a year, that's what I take for 25 years now. So I wonder if the pharma model kind of, I don't know, if you remember back in that time when people would come in and ask you for a drug, they're not doing that with digital health necessarily yet to that scale and or med tech devices.
We are seeing it somewhat with devices and with wearables. We're seeing folks bring that data in and kind of ask if there's an issue. Is there something that I need to get taken care of? And then we're getting questions in regards to what might be best for someone. And so I do think that consumers are feeling more empowered, or I should say patients in this respect, are feeling more empowered to come to their healthcare provider and have a conversation where it's really about how do I make the right choice and what is the right choice for me, as opposed to the previous old model of just getting told what it is that was best for them.
Yeah, this is a very similar example if you steal the case from retail. So when you shop on Amazon, people who bought this also bought this. I think in a similar manner, as the industry figures out how to understand individual patient and through their data, it would be patients who use this, patients of the similar type also use this. And I think that's where the personalization and understanding patients with similar histories, similar backgrounds, the industry hasn't gotten there yet. And I think it's, again, a big data play, understanding of the data, initially capturing of the data, with privacy by design, regulation by design, data quality, data governance, managing through all of these. And actually, we can totally imagine the industry headed in that direction.
So I'll just add one last comment to your original question. So payers only represent a fraction of the people who are receiving care, right? So if we're gonna infuse consumerism, that also requires advocacy. And so Medicaid is a state program. So that's 50 separate states that have to be lobbied, and each of them have a different definition of what Medicaid is and what the thresholds are and what they're willing to pay for or not pay for, and the formularies are different. That's just Medicaid. Medicare and the Medicare Advantage side is the federal program, funded federally, and we have very, very specific guidelines we have to follow. And so if we're going to move the needle, the regulatory environment also has to be moved, if not as fast, faster than the industry, because without the approvals to do the things that we know we can do, we find ourselves hitting a brick wall.
Shay, I think we have an audience question, but just on that last point with the regulators, I think that's an important thing that we haven't touched upon yet. FDA, it's not going to be possible, at least in probably the foreseeable future, for the regulatory bodies to move as fast as what we are doing on stage does. And the payers probably in turn have to wait for those to understand. But I will say in my discussions with FDA, and again, it's not because any of them are potentially in the room here, although there are some of our regulators and our friends from DC here today, all of us look at them as our partners, not as our adversaries, because we kind of learn together, especially a company like us that's doing AI-based hemodynamics. That's not something that they've regulated before in a home-based standpoint. So while it's been frustrating because I have a small balance sheet, from a science perspective, with my biomedical engineer hat on, this is how it should take 2.5 years to go through all of the edge case tests. And what I mean by that is FDA is kind of adopting this point of patient and consumerism. Beforehand, maybe even up to maybe 15, 20 years ago, you could do a approved IDE study at Cleveland Clinic on, I'm picking a number here, 200 patients. They could be all male, all white, and you would get an approval. FDA is not doing that anymore, right? You need rural geographies, you need urban geographies, you need every ethnicity that follows the US Census, you need every age, you need every BMI. That is taking a consumer approach. And I think that is kind of optimistically as well, that while there is going to be time laggards, Tom, to your point, everyone's still getting on the same train track, which is good.
Question? Go ahead.
Thank you so much for this conversation. I think it's incredibly important to have it, especially in the US market that has sometimes contradictory incentives, and it seems that sometimes patients are the ones who only care about the outcomes for their health. I wanted to see your comments. So on the other side is that when we bring consumerism to health, it can become a driver for disparity as well, being that there is only the people that can afford have access to that particular technology. And so what are your thoughts about how can we actually ensure that moving forward, we actually don't create that gap, yet another gap in the system?
So I can start from a payer perspective. And like I said, I currently work for a government programs organization, and so advocacy is key first. There are solutions, but we have to, the funding mechanisms for our organizations like mine have to include that kind of technology. That's one. Two, where we have ROI, the payers will adopt those technologies and make them available to the broader population. It's Medicare and Medicaid represents over half of the U.S. population, and to your point, they typically don't have the funds to go out and get the Apple Watch and the newest technology. So it has to come through advocacy and an ROI that can be proven. And when that happens, then the organizations like mine will adopt those technologies and push them out to the broader population.
I would say the biggest value prop of digital health is to drive down costs and also to increase access. And I would say as the industry matures more and the choices increase, the competitive pressure will play a key role in keeping some of those costs down.
I completely agree with Tom when it comes to the advocacy aspects and the ROI. I'll tell you about an example that we're seeing out of Ochsner right now in Louisiana, which is just a great example of how you can actually cross the equity divide, which is they have a clinic there that was noticing that a large proportion of their population had uncontrolled hypertension. And so what they decided to do was create what they call the digital hypertension program. They gave people a Bluetooth connected blood pressure cuff as well as a phone, and then had them take blood pressure readings at home. And patients, by doing that, the device then uploaded it directly into the health app in the iPhone, and through our HealthKit API sent it back to the Epic EHR, where a pharmacist on Ochsner's side was looking at the data. And they said, we're going to contact anyone that's out of range. And in doing so, they found that within 6 months, they were able to get 80% of the uncontrolled population under control. And what's even more interesting is that they were actually able to decrease utilization of the clinic by 29%. It's been so effective that they've started a digital diabetes program as well as a connected moms program. But the reason that Ochsner is able to do that is because they are a part of a managed care population. And so they take on risk and they're looking to decrease it. And that's why it makes sense for them financially. And I think it's about finding creative new ways to make the money work out in folks who are not in those types of managed care populations.
And just to close that point, Ochsner is one of those forward-leaning providers, which is great. But to close out the question there, and to Lauren's point on the provider, I think when access and democratization can start to really filter down, in addition to the points Tom and Lauren just made, and I hate to say this, but there is going to have to be some adoption on the risk side from a patient standpoint as well. And we're not going to literally, from a one-way street, be able to give everything to the patient. The patient doesn't engage themselves, right? And so I loved what Ginny Romnetti said, the chairman and CEO, former chairman and CEO of IBM yesterday when we were talking about AI. He's like, everybody loves AI for the worst reasons and is petrified of AI for the most important issues. And so I think tying those things in together, the real stakeholder that it kind of matters is the patient. And I thought the Ochsner example was great because they wouldn't have done it on their own, short of it not being pushed out. And then when I say risk, they were kind of taking that into their own hands of, well, I'm going to send this out every day, and I'm going to trust that my pharmacist is going to make the right decision for me or bring me in or something like that.
Say there's also another way that I could see this happening, which is getting to Venk's point about patient risk, is that it's about helping folks also engage in the healthy actions and moving ourselves away from a reactive system to one that's really about proactive preventive care. And so we're seeing this where some insurers are doing programs where they'll actually incentivize people with an Apple Watch. And so they'll say, you will get this free of charge, but you have to earn it. So we'll give it to you. And then if you engage in the healthy actions that you need to do over a year's period of time, then that device is yours. And so they're really starting to encourage people to become healthier. But the ROI on something like that is really hard to measure when it comes to prevention versus reacting to something that we know is already there.
Yeah.
So to the point we're talking about, I'm coming at this from a facility operator. I sold my facilities after the pandemic, but we just kept on seeing rehospitalizations with easy stuff, right? Whether it's stuff that's measurable on a watch or whatever device. Why shouldn't rehospitalization savings, which is no secret is the biggest cost driver payers and for the system in general, be the funding source for the proactive use of these devices for patients that are already engaged because they already have a problem. Why aren't we seeing that?
So I think we are. We're seeing it through partnerships from a payer and a provider partnership perspective in what we call a value-oriented deal. So you have your basic funding mechanism, but then you put a little bit of the skin in the game with the provider and you share in those savings. So those are happening, and the volume of providers who are participating within those is increasing. And from a payer perspective, that's what we want. We want engaged providers that take both upside and downside risk. There are some states where adoption for those kind of deals is very high, and others where it's incredibly low. So it's moving in that direction, and we will get there. And I think even CMS is starting to push for those type of reimbursement mechanisms. But I think that's part of, to your point, how this problem gets solved is that everyone is engaged, and then Bank's point about patient engagement, that's the secret sauce, and I don't know how to get there yet.
I'm curious, Tom, what you think in terms of what's going to speed up that transition, because you all get so tired of my examples, but we have another example coming out of Johns Hopkins, which has been interesting, and it was the Corey app that was designed to actually prevent 30-day readmissions after MI. So 1 in 5 will actually get readmitted after they've had an MI, which is at a tremendous cost to both the patient and to the system. And so what happened was that they decided that a comprehensive self-management tool would help to mitigate against this. And so when folks came in with an MI, they gave them an Apple Watch, they gave them an iPhone with an app designed on it to kind of walk them through all the actions that they would need to take. It also included education. And then they sent them home with all of that. And they found that 30-day readmissions to the hospital dropped tremendously. I think the national average is around 20%. They were down to 6%. They estimated a cost savings about $10,000 per patient. And this was something that was done years ago. I think if I remember correctly, it was about 5 years ago that they published the results. And they continued to expand on their program, but I haven't seen it scaled to many other institutions. And so I am really curious from your perspective of what's going to move the needle more quickly.
It's a good question, because the sophistication of providers across the country spans the entire spectrum. So the larger, sophisticated providers that can manage and track programs like that, those programs are in place. But there is a whole subset of providers in this country where they're still using fax machines, right? That their patients in the rural part of South Carolina know them and have known them for 40 years, and they're not changing. They don't have the money to invest in a new EMR or the systems to manage what they would call fandangled technology, right? They don't care. They have their way of doing things, and this is how it's done, and they don't have the money to invest in the infrastructure it would take to get there.
And we will get NanoWare on all of those patients post-MI. Just the last point, I think the last point you made, Tom, to Lauren's question, I think is an important one that we may not have touched upon. I think the thing that's very different about healthcare than other industries is that it's very regional. The patient population in Johns Hopkins, for example, very different than the Ochsner population. While, Shay, your example, people buy Coca-Cola across the world, right? People aren't buying a unified, standardized blood pressure cuff, for example, in the rates in New York City versus Mississippi, for example, right? So I think that's an interesting point that kind of makes this discussion still a little bit circular as opposed to linear, the regionality of healthcare.
I guess this is a question for Tom. Do you feel Centene is moving fast enough, too slow, or too fast? And
They haven't given NanoWare a contract yet, so.
I ask that in the context of, consumer devices, hospital devices, and we've gotten to a point where it feels it's not moving fast enough, and that payers aren't getting ahead of the game. Therefore, we're seeing a VC actually buying a healthcare system today, trying to move the technologies a little bit faster, getting folks healthier, getting outcomes better. And so, is Centene moving fast enough? Are they too slow? Or do we need a new model to kind of buffer, the expectations that consumers have kind of moving forward?
So I'll answer from just the payer perspective, not just Centene. Everyone wants to go faster. And going back to one of my earlier comments about advocacy and regulatory barriers, there are an awful lot of barriers that prevent moving us forward. The pandemic was a massive jump forward. And even for me, I was the CEO of a company in Minneapolis and offered telemedicine and teledigital visits. I had never even taken advantage of it myself, right? Then the pandemic hits, and the infrastructure is there. We go from 1% utilization to double-digit utilizations, and it's super easy. And to your point, where we were, the doctor will see you now. Now it's I will see the doctor now. We're shifting very, very quickly. Not fast enough, but the leap has been exponential in the last 5 years.
And one other point on that, healthcare, another part of it, I think, is that unfortunately it's generally, or maybe the volume is more restricted to the elderly, because that's who has more chronic disease, stuff like that. With the younger generation coming up, which lived an entire digital and tech-enabled life, it almost has to your point, right? Because the expectation of even the kids in med school now, right, on the provider side and patient side, is about faster, better, quicker, cheaper. Like, that is how they've grown up. And I think it's a matter of time.
It is.
So I asked that.
Because both my kids are in college, and I don't know that either one of them has actually gone to see a PCP, but both of them have done the teledigital visits, and that's just the expectation.
Right.
I mean, I asked that because there's a feeling that we're in a conference with a lot of innovation coming through, and the main hurdle and the barriers, despite all this data, research, outcomes data coming out of specific populations, but it's always the payer that feels like they're a barrier to actually just really improving lives. And therefore, again, I'm wondering if a better program or a model or a payer model that's gonna eventually come up, and we'll see what happens with this Intermountain light example that's coming up, but is there a better model that's gonna overtake what Centene is doing, or should Centene still really reflect on what they're actually doing to try to promote some of these technologies, services that really drives better outcomes?
As the one company up here that is not big enough to have a sales team yet, I can comment on that in a pretty profound way. When we thought about our business model, which is really what you're getting at on innovation, initially when we were going after cardiopulmonary care, from stage 2 hypertension to structural heart and heart failure, which is where we focused on, the logical idea was what we were hearing. 30-day readmissions, we can do the savings, so we'll sell into clinics and health systems. But everything that we do, we're trying to fit under a 40-year-old CPT code for the EKG or for the blood pressure, and you can't total all of those up. And so I stopped. I actually gave up on that model, because until I have 3 years of real-world evidence to go get my own code or to show Tom the outcomes, investors are not patient enough to sort of fund that, right, post-approval. So I think this, and again, I'm not saying that the model we have come up with is correct, but this could be a sort of example for the innovators, and I think it's actually going to drive a lot of this consumer engagement or patient engagement. We sell to clinical research organizations and medical device companies directly, who want to understand our data services about their products. What are the cardiopulmonary effects of their products or their drugs from phase 2A to post-market registry? And because these clinical trials are 3-5 years sometimes, these patients are on our platform for a long time. So we can give our hardware away for free and customize the sort of data services that we do. And what I've seen in that model, and it's very early, what I've seen in that model is because we can deliver these solutions at home, and we're not asking clinical trial participants to come in 30 times in 1 year just to get their checkups over 4 years, you're actually expanding the pool of who's engaging, right? So now you're not just focusing on the sickest of sick patients who are like, I'm gonna jump into the study because I got no other choice. You can mix it with healthy patients, with young patients, and start to drive that engagement. But your question is the reason we kind of found that model. It was almost, we were forced to, right? And I think maybe if more sort of take that approach, and it won't be for every technology, you're building the real world evidence in real time at a patient's real life at their home outside of the physician and hospital office. And one day we'll see the outcomes that hopefully Tom will give me that contract. Sorry, I'm always selling, right? Gotta keep the lights on.
So I will let Tom comment. Also prep the audience. We'll do one more question, yours, in a second after Tom goes ahead and responds to the previous question. I will say one thing for the audience. So when we're done, I'm going to ask you all, of course, to give a huge round of applause to our amazing panel. I will point out, when I called Tom, I said, look, there's not a lot of private payers. There's not a lot of payers at this conference. You got a lot of innovators who see you as the problem. Are you interested? And I've known Tom for a while and knew what his answer would be. Tom was like, absolutely. These are the conversations that are critical for the ecosystem to actually change healthcare. So while I'm going to let Tom answer, and you'll all leave here mildly dissatisfied, probably, with all of his answers, I would suggest to you that these are the critical partnerships that get us to a different place. And Tom is a great leader in that. Again, I've known him for a long time. So, Tom.
So thank you. I did tell Shay, I said, so I'm the sacrificial lamb at this conference. But to his point, and he stole my thunder, the reason I said yes is because these are the conversations we have. And for Centene or any of the other payer organizations, our goal, our missions are all very, very similar, and that's to improve health outcomes. Our entire reason for being is to make people healthier. Right? And so finding ways to do that is what we do. And there are multiple different barriers out there, and our job is to overcome as many of them as possible, whether it's through advocacy or technology or partnerships with physicians or technology companies. That's what we're doing. So
I realize we're over time, so I just wanted to say thanks to all of you for doing this. And there was a panel that was probably more relevant to my actual work, but I wanted to come to this one. And while I'm disappointed that there aren't more people here, I think it's actually sort of reflective of the fact that this is the most important conversation that we're not having in this country. And maybe a contrarian point of view from earlier, I feel like culturally, as soon as you call it healthcare, nobody thinks that they should have to pay for it. So I don't know if it's a generational thing that ultimately overcomes this. I was really encouraged to hear Venk say the comment about sort of commingling these quasi-health applications with things that are more consumer in nature, right? Like consumer by nature, you have to make trade-offs. But if you can almost like trick people into not thinking that this is health and that therefore they can engage in that same consumerism that they do in literally every other aspect of their lives. I'm thinking about HSAs are 20 years old this year, not really super heavily utilized, but thinking about writing congressional letters in 2006, consumer-driven healthcare, you don't call anything else consumer-driven, but for some reason we have to do that in healthcare. So I just wanted to say thanks for everybody having this conversation.
Thank you. Well, I think we will, I'm going to let everybody, lightning round, make a couple more comments, and then as I said, I'll ask everyone just to give a huge round of applause. But thank you for the comments. I think obviously this is an important conversation. Coming into AdvaMed and being able to lead our new digital health tech division, I think all of our member companies, whether it's Apple or ResMed or many of the companies you see around here, like digital health is healthcare. If it's not, it should be and is becoming. And Tom and I were chatting before this, and Tom reminded me when I asked, are expectations going to get met? And Tom said, well, you know how all of us use technology. And then he reminded me how it's not that long until we're moving into Medicare, and how that impact might dramatically change things or at least influence it. And so I'm both terrified on that realization, but hopeful. So we'll go one by one. Tom's taking the arrows. I'm going to let him start. We'll close with Venk. Just a few short statements, closing thoughts for the audience, please.
Well, first thing, Shay, thanks for the invitation. I really do enjoy these kind of conversations. Maybe I'm a glutton for punishment, but they're the conversations we need to be having. I would say that from the payer perspective, and I'll go back to my earlier comments, consumerism is the future. It's where we are moving, whether it's a government-funded program or an individual or under the commercial employer model. All the different funding mechanisms and how it gets paid for will figure itself out, because the consumer is starting to demand it. And as that population that grew up with an iPhone ages in, they're going to demand it. And so I'm excited about what the future brings. I'm excited about what all of you are doing in terms of developing these technologies that will be integrated into the system, and all of us together driving results to improve health and outcomes. So thanks, Shay.
I'll say, just the panelists on this stage here, we have a payer, we have a mature tech company in medtech, we have a startup tech company, we have a physician, we have all the personas here that are necessary, and we have all of you here that's necessary for us to drive that change. And I think, as Shay was saying, first it happens through conversations. We're having those conversations, and that will lead to actions, decisions, and change. So I'm super excited about that.
I'm really struck by the last audience comment, and I think there is something that really strikes a chord for me, because when we think of health or healthcare, it's something that all of us kind of groan about. It's onerous, it's burdensome, it sucks, no one wants to engage in it. And so I think as we enter kind of this new realm of trying to find new and interesting solutions, it's really on each and every single one of us to think about the experience that drives delightful, engaging, and fun experiences with health. So we start to turn the story around a little bit. I know it's not an easy thing to do, but I think that it's really something that all of us should be putting our heads together to think about.
I loved that last point, and to answer your question, we have to somehow make healthcare fun. And I think that's a good tie-in on what we're talking about. Consumerism's fun. Buying things is fun, getting upgraded to first class, it's never more fun for me, But I'm optimistic that we can get there. And again, I'll bring it back to the generational shift that has grown up with fun, right? You can't give the kids more fun right now compared to how we grew up. You see the kids, when they're on social media, they're pulling down the grill, right? Because having nice teeth is cool now, showing their stomachs if they have flat stomachs, because it's that's the cool thing. That's what's fun now. And I really think that this convergence of technology and industry convergence, from a consumer electronics company to a med tech company to a payer, that's where this is going to take up. I'm really excited for the next 5 years. I think it's going to be this particular point that we've been discussing, I think, is the most important, and I hope we see some really, really good trajectory from it.
Well, I feel smarter, more hopeful, and a little bit excited. I hope all of you do too as you leave here. And as Venk said, for the rest of the conference, please have some fun and celebrate our panel with me. Thank you.